Hello, and thank you for listening to this special episode of Checking the Vitals, a podcast powered by SpecialtyCare. In this special episode, we focus on the COVID-19 outbreak that is currently happening in the United States and around the world. We speak to Courtney Petersen, a clinical manager for perfusion at SpecialtyCare. She shares with us what is going on the front lines at the hospitals in Denver where she is located, and some of the challenges that frontline clinicians face day to day with this new COVID-19 reality. We also share some insights and some awesome things that are happening on the front lines as people come together in both the community around Denver and the team servicing the patients every day in hospitals in the Denver area. Please keep in mind that things are changing day to day with this COVID-19 outbreak, and that if you want the most up-to-date information, go to the CDC at cdc.gov. Enjoy the conversation. So, Courtney, I really wanted to start off this interview by asking sort of a simple question that I think a lot of people are thinking about when it comes to healthcare and hospitals, and that is healthcare workers, how has their job changed since COVID-19 or the coronavirus has come to the U.S.?
You know, I think the first thing that comes to mind with what my team's experience is fear. I think a lot of healthcare workers across the country and definitely across the world are just afraid. First, we were hearing protective equipment is going to run out.
Right.
We heard that weeks ago. We didn't actually feel it until now. I can tell you this week, we are feeling it as a hospital. We are feeling it as a team. We are being asked to reuse our N95. So perfusion, we're all just hanging on to our masks.
Yeah, and so just to kind of clarify what that is for the audience, those are the masks that are designated to sort of prevent this specific virus, because they're not just regular surgical masks, right?
Correct. But even the regular surgical masks are running out as well.
Oh,
but yeah,
wow.
So N95s are very specific. If you are entering a COVID positive patient's room, you should always have an N95 mask on.
Right.
So just to back up, my team is a team of 5, and one of the first things was, well, what are we being given to protect ourselves? We're now being asked to take care intimately in the same ICU room or in the same OR as a COVID patient, to be taking care of them, to be spending hours and hours with them a day.
Right.
So a lot of fear with things running out because it's actually already happening. Things are getting scarce. People are starting to stockpile gowns in their corner of the ICU or hide, block masks in drawers. So nurses are only given 1 mask a day per shift. And if it gets soiled, you get a second one, but that's really hard to come by. So things are just getting very different. Just something I never thought I'd experience. Gloves are running out. Masks are running out.
Yeah.
Cleaning wipes are running out.
Wow. So that surprises me some, because COVID-19 is, has a very specific mask you have to wear, but I'd imagine the gloves and the gowns are the same. So is it just because the increased patients? Is that what's causing those other ancillary protective equipment? Is that what it's causing those to run out?
Yeah, so we don't always have to gown up or even mask up to enter a room.
Oh, okay.
Lots of patients are on isolation for other reasons, but COVID patients are treated with, isolation protective equipment. And we have nurses and perfusionists going in these rooms or going into ORs 20, 30 times a shift. And we are, inundated with COVID patients. To give you a number, on Monday, I think our hospital went through 500 masks in a day.
Wow, okay.
By Tuesday, we went through 3,000 masks in one day.
Wow, so that's a huge increase in just one day. Was that because of a huge increase of COVID patients?
I think it's a big increase in COVID patients. It's also a big increase in people, again, feeling afraid, wanting to protect themselves, wearing masks just walking down the hall.
Sure.
Just really getting over cautious, which isn't a bad thing, but it then, in turn uses more materials.
Yeah.
So that's a big change.
Absolutely.
On top of just the feeling of fear, we are a small team and we do have something we call ECMO, which is a life support system that's able to take over these patients' lung function.
And let me just say this, COVID specifically is attacking people's respiratory systems, right? A lot of the symptoms show up as a respiratory illness. Is that correct?
Exactly. So a lot of patients who are failing ventilator support, their next step and their only next step is to go on something called ECMO, extracorporeal membrane oxygenation.
So that is literally the last step for these patients. Ventilators have failed them, and now your team is acting through ECMO as sort of the oxygenator for their body, like what their lungs would do.
Yeah, exactly. And there is no other option after ECMO. So,
right. So
yeah.
You guys are like the last line of defense for these patients who are in the most need.
We are at the moment.
Yeah.
Definitely.
So with a small team of only 5, is that putting stress on how many hours you guys are working, and what are you guys doing to sort of combat that?
Yeah. So that's another big change for our team. I know across the country, a lot of elective OR cases have canceled,
Yeah.
Which some of our colleagues has made their days quite slow. But on the flip side, we are very grateful for that because we are working at the moment 8-hour shifts, 3 8-hour shifts throughout the day, and then someone's available for OR emergencies as well. So most of us, if we're not actually doing a shift that day, we're call or backup call, or we are OR emergency call. So there are very few days off where any of us get to go home and really just shut it down at the moment.
Yeah, and to sort of relax and recoup before your next shift.
Exactly. Yeah, my big thing is I want everyone to be able to go home, even if it's just for 8 or 16 hours, and decompress as much as possible because they're going to be asked to come right back, and it could be in the middle of the night or it could be by their scheduled shift the next morning. Things are just very up in the air for everybody.
Yeah, it sounds sort of like everyone's on call, whether they're at the hospital or not.
Exactly.
So what are some ways that you are sort of as that clinical manager who's sort of over that team, what are some of the ways that you are sort of coming together to, I guess, still provide the support that is required of you, even though it's a lot more support than you guys normally are capable of?
Yeah, it's very challenging to keep the morale up, I think. It would be for any team who's experiencing something
Absolutely.
so uncertain. We don't know where the end is. We don't know when this is going to let up. So how we're dealing with that as a team is constant communication. We have, conference calls because we're not seeing each other face to face quite as often if we don't have to. Keeping them totally up to date on the plans, on the scheduling, the if and whens. I'm always planning, plan B in advance.
Yeah. Because
there could come a time where we actually are running 2 perfusion teams in-house simultaneously if we had that many ECMOs running at a time. So I try to ease the uncertainty or the confusion or the lack of expectation awareness for the team and hope that can take some stress and some fear off their plate as much as possible. And then we reach out to the company and seek any travelers that are willing to travel during a time like this, just to allow us a couple of days off anytime during the week. So we actually do have a traveler coming to us hopefully today.
Awesome.
And that might just give all of us one day off, in the coming week or two, but that's more than we would have without them. So that's a huge help as well and gives people kind of a mental break and an emotional break as well.
Yeah, absolutely. Let me just ask this just to sort of clarify. That traveler, is that another specialty care perfusionist that is flying in from an area that maybe isn't as impacted by COVID? So they have a little extra time to come out and help?
Yes.
Oh, that's awesome.
Yep. That's a huge relief that is obviously taken very well by the team. It feels good to know that something is coming, even if it's just temporary.
Well, yeah, and to feel support outside of your team. I mean, I realize Specialty Care is a very big company, and there's a lot of perfusionists that work for Specialty Care, so you don't feel so isolated in Denver, because you have someone from, and forgive me, I don't know the city, but from somewhere else to come in and help out. It's got to help with that morale that you're, struggling with.
Absolutely. And I try to keep saying, and others are, echoing the same feelings, we're just very grateful to still have work. We still have paychecks. We have very meaningful jobs that we're going into, albeit very stressful. But we try to look at it like this is not just a terrible time, but it's an opportunity for us to work hard and give back to as many healthcare workers around us and patients as possible and try to see any positive in this chaos that makes it easier to get up and go to work every single day.
Absolutely. So let me ask you a few questions about the hospital specifically, because you mentioned that the hospital is rationing sort of the protective gear and stuff like that because of shortages. Is there any hope in the future of getting more protective gear?
I think the hope that the hospital has been giving us just in this last week is this idea of recycling masks. There are companies out there saying that they can take old masks, whether they are just the regular surgical, as we discussed, or the very specific N95. And they've said that they can actually refurbish, re-sterilize, whatever they do, and recreate them and give them back to the hospital.
Okay.
So in that regard, we have a little bit of hope there. We don't know how that's really going to play out, but it is a plan.
Yeah.
As far as, some of the other equipment, gloves, gowns, wipes, I really can't tell you. I just know that everyone is aware that they're running short, and so we're all trying to be as mindful with our use as possible.
Sure, trying to be as strategic as possible. Let me ask this, because I know on the outside, people who don't work in hospitals like myself, we are asked to sort of just stay in our homes and, social distance if we go out. So stay 6 feet away from everybody, whenever we can, if we do go out. You guys having to go into the hospital, which is a high risk area on a normal day anyway. Are there precautions that you guys are taking in the hospitals that are sort of similar to what we're being asked to do on the outside?
Yes. So in the hospital, we have units, we have wings, we have areas of the hospital where we try to consolidate our COVID patients.
Sure.
And when you are there working in those wings, you don't just freely walk around the hospital from wing to wing, going from a COVID to non-COVID. We try to stay as consolidated as healthcare workers as possible.
Okay.
As soon as I enter the hospital, I put a mask on because I don't know my exposure risk to other people. And that's a good point I wanted to bring up. The CDC has outlined 3 types of risk exposures: low, medium, and high, and what you do if you've had any of these exposures. So I can tell you everyone on my team has had a low risk exposure, and we do every single day we come to work. And what this means is the COVID patient is wearing a mask or is intubated, and we also have our face mask on or our N95. But we're in the same room as a COVID patient. That is considered a low risk exposure.
Right.
And so we're all walking around as those individuals, which is very important for me to not go out in public. I haven't gone out in public. I won't even go to a grocery store. Thankfully, I have a partner who does that for me, but I don't know, what I could be carrying just by virtue of my job.
Right. So your precautions extend even outside of the hospital. So, you obviously take the precautions when you're in the hospital, wearing the masks and whatnot, but also when you go out and are heading home. Definitely. It sounds like you pretty much just go from the hospital to your house and back.
Yeah, I do. I too fearful that, I could be a carrier and not know it. So I don't take any risks if I don't have to for others, not for myself. But yeah. I think a lot of us feel that way, and it's important to try to stay home as well.
I think that's absolutely a very, very good point to make. Also, I've been seeing reports from the CDC that up to 17 to 20% of people that have COVID-19 express no symptoms. So they have no idea that they're carrying it. So that's a very good point to bring up and drive home. If you don't have to go anywhere, don't. If you do need to go into the hospital, try and make that the only place you go. I think that's a great way to help sort of stop the spread and really support what you guys are doing at the hospital, because the more people that get sick, the more people that have to come in, the more strain it puts on you guys.
Yeah, definitely. And it sounds like, our hospital is into less than double digits of ventilators. And
oh, wow.
So we are really hitting our numbers already. And I think a lot of people feel that we still have quite a long road ahead of us. So.
Yeah, I think we are at the early stages of what they're saying is the curve, right? So we're trying to mitigate how high that curve goes by isolating as we have as a company and things like that.
And the patients that are put on ventilators or put on ECMO, so these really, really advanced supports, obviously not every COVID patient ends up in this situation,
sure.
But a lot of them are, more and more every day. But these are not short-term supports. You're not going to be on the ventilator for a week and then you're going to come off and be fine, or you're not going to be on ECMO for a week and then come off and be fine. These can be going for 3, 4, 5 weeks, where that device, that ventilator and that ECMO machine is going to be used up on one patient. So they're in it for the long haul, and this equipment is then going to be even harder to find because no one's coming off the equipment they're being put on very quickly.
Right. I mean, that makes sense. If you have, 8 patients that need to be on ECMO for an extended period of time, that's eating up 8 ECMO machines for a month, perhaps, and if you only have 10 at the hospital, and I'm just throwing out numbers because I really have no idea what those numbers typically are, but I mean, you only have 2, and that's going to be scary when you get down that close to the end of the supply. So I think that's very, very understandable. So a lot of what we've been talking about is sort of the negative of what's happening around COVID-19. And there's a lot of scary things that, we've been talking about and people in the news have been talking about. But are there any stories of inspiration that are happening, or some things that you maybe didn't expect that are sort of heartwarming that have been happening with your team or at the hospital you guys service?
Yeah, so just the first thing that comes to mind is just last night we were approached and provided, actually a ton of people in our hospital were provided free meals from a nonprofit in Denver called Lunches for Clinicians.
Oh, that's
and
awesome.
I don't know if this is just built around this COVID outbreak, or if this has been something that's been around for a while, but what they're doing is they're collecting money from the community.
Yeah.
And they've already collected almost $20,000.
Oh, wow.
They're then taking that money and using it at a local restaurant in Denver to buy a ton of meals for a group of, workers, healthcare workers at a hospital. And then they're delivering that food to the hospital every day. They're doing that.
Oh,
So
that's awesome.
by taking donations from the community, they're giving back to the restaurants who are struggling, and then they're providing free food to healthcare workers. It's just really amazing.
Yeah, I was going to say that has more of an impact than just feeding hungry clinicians, even though that's very important. It's uplifting for the team as well. They feel valued and appreciated, but it also supports the small businesses in the area who are undoubtedly struggling right now.
Exactly. I mean, they did it with coffee, pizza. So they're just, they're reaching out to small businesses and getting money into their pockets, and then in turn giving some happiness to the workers. So I love that. That just happened last night during my shift, and I thought it was just one of the coolest things.
Yeah, you actually took some pictures and sent those to us, and if you're okay with it, I'd love to actually share those in the video of this. So if people want to go to the video and see those pictures, I'd love to share those. So is there anything else that's going on that has been uplifting at the hospital?
Yes. Well, at the hospital, everyone's just having each other's back, but even within SpecialtyCare, our neuromonitoring colleagues in Denver, who we really don't have any interaction with whatsoever, and none of us probably know each other, one of their clinical managers reached out and just offered to help in any way they can. So whether they're like, can we come in and clean your machines? What can we do for your team? And so just getting that from the company from a different service line was very uplifting, and I shared that with the team. And it just means a lot to know that people are trying, even if there's not much they can do.
Yeah.
So that was a fantastic kind of reach out, feel good moment. And even our CEO, Sam Weinstein, has reached out and asked if he could send along encouragement to the team. And that just shows a lot of support within the company that we are all feeling and very grateful for as well.
I know that Dr. Weinstein is very passionate about helping everyone feel supported and communicated to. We're working as a team to get as much communication out as possible during this time so that people aren't wondering what's going on, what should I be doing, those kind of questions. We're trying to answer all those up front because clinicians in the field have enough to worry about without having to wonder, what's going on with their employment status or, that kind of stuff. So what else is going on out there?
Just even as a team, we're a small team. Just last night, I'll throw Allison out under the bus. It's something so small, but she brought me, she's a colleague, and I went and relieved her last night or yesterday at 2:00. And she took me back to the lounge and she handed me a box of donuts. And she just said, this is for you to take home or to share with the nurses this evening. It's just such a small thing, but she came in at 6 that morning. And I don't know where in the world she found time to grab donuts for me first. But it was just a very small act of kindness that just brought, it just made the shift that much better. It was just a great way to start that day and so appreciated. And everyone is doing little things like that for each other all the time, which really adds up.
That is awesome. So I know we've been exchanging emails before we did this, and you had told your team that you were going to be doing this podcast. And did they have any messages that they wanted to pass along on this forum that we have?
They did. So I do want to share one email that I got from one of my perfusionists, Casey Baumgartner, that she wanted me to share with you guys, if that's all right.
Yeah, absolutely.
Fabulous. Okay. So she says, as a perfusionist, I think most of us have this innate response to run towards a fire. And this is exactly what this pandemic feels like, a fire. Putting yourself in danger to care for those who cannot care for themselves, a sense of urgency. You're a part of their life-saving team, their last chance. This innate urge puts everything else on the back burner. Home life, relationships, family time, because it's all consuming. Making sure patients are safe, making sure cases are covered, pulling overnighters, all while having frustrations with the system, but complying anyway because it's the process, the right thing to do. In the end, when we overcome, this will be one in the history books in new perfusion editions, and we have an opportunity to continue to refine our practice to again come up with creative ways to push our equipment limitations and supply issues. She really ended it there, but I think it was just really well said.
Yeah, absolutely. And I do think that this is sort of a trial for the ages for all of us here, and especially for our healthcare workers. So just from all of us on the outside, I just want to send a big, big thank you for those of you on the inside of these hospitals. It means a lot to us.
Thanks, Todd. It's really appreciated to be able to talk about it and get feedback from you guys and just having the support that everyone's trying to show in such a confusing time has been really great.
Absolutely. Well, thank you so much for being on the podcast. We really appreciate it.
Thank you. Thanks for the invite.